The Step-In H Anatomical has been designed for the patient, but in respect of the caregiver's needs. In the following video, you will discover what the Step-In H Anatomical has to offer. The hand control with its clear contrasting pictograms is easy to use by all patients, even those with limited eyesight. You will recognize the pictograms for the backrest function, the leg rest, the seat tilt, the height adjustment, and the footrest length. Before letting a patient in the chair, make sure the brakes are applied. This will prevent the chair from moving as the patient is trying to get on the chair. The brake pedal can be mounted either on the front or the back of the chair. When activated, the brake will lock the forewheels. To allow a patient to get on the chair easily, simply lift and pivot the armrest. This chair has not been designed for front access. The tilted leg rest stops this possibility. Once the patient is sitting comfortably, we can use the chair elevation control to bring the chair at a comfortable working height. This is an important feature for the caregivers, since it helps in preventing back injuries caused by working with the back completely bent over the patient's arm. When a patient has a catheter, you can raise the armrest. This action will allow you to get closer to the patient, therefore it will prevent you from lowering your back to get closer. Once all the preparation is finished, you want to make certain that the chair is lowered to its lowest position. To maximize patient comfort, you will want to remind the patient to use a variety of positions during the treatment. When the backrest is lowered, the seat tilt should also be used to stop the sliding forward, and this will prevent any shearing discomfort on the patient's ischiums. During the treatment, if a patient suffers from cramps in the legs, he will be able to remove the cramps by having the motorized footrest push against the feet. The chair has a red emergency Trendelenburg button. From a treatment position, the patient will be in full Trendelenburg in less than 8 seconds. Once the treatment is finished, and before the removal of any connections on the patient, make sure to raise the chair high enough to a comfortable working height. When finished, do not forget to bring back the seat to its lowest position before allowing the patient to disembark the chair. After each use, the chair will need to be disinfected. During a normal procedure, you can use products such as Clorox wet towels or others. Never use alcohol. If you use the chair with a known infected patient, or if you have a bleeding accident, you could, if necessary, remove all the cushions to obtain maximum disinfection. Most of the chair components are snap-on, snap-offs. There are only a few bolts and screws to be removed in order to complete a repair when needed. The motors are attached by 2 screws and a connector to the control box. In order to prevent downtime with your chairs, we recommend that you acquire a few extra cushions and other components that we will gladly indicate to you.